So your use of red light when you're in Germany, you have sleep apnea, you don't have to use it for a really long time. You also don't need to have high intensity light either. Okay. But when you think about all the physics that I'm laying out to you, you're going, Jack, that's a lot. Even for my German audience who likes engineering and is into that. Well, Lars, now do you understand why I say just get in the sun? Sun is TINA. What does TINA stand for? There is no alternative. This is the reason why when people ask my opinion, Jack, what's the best red light to buy? There's no better answer than the sun. So like what Benny is doing right now actually answers your question. I think that that's the ultimate answer. And then here's the other side for you that I want you to know, that the more you do, like the more the sleep apnea is, that means the more time you'll have to spend. So I know this is an inconvenient truth, for some of the people in Germany that'll be listening to this, but you have to realize something. If you don't fix this problem and you already have sleep apnea, it basically predicts that you're going to have future brain damage. So this talks about, do you understand now why people are getting Alzheimer's, frontal temporal dysplasia, Parkinson's disease, Huntington's disease? Here's the big one. You know what another chemical that leads to a pretty nasty disease, ALS. You know what chemical is related to that? Catalase. Remember I talked about catalase before? Do you know that catalase quenches hydrogen peroxide into water and oxygen? When that doesn't happen in neurons, guess what? You get ALS. So when you want to know, like, it's very nice to understand that sleep apnea, tinnitus, and cataracts are all predictors of future brain damage. Most people never want to get the ALS. Most people never want to get the Alzheimer's. What am I telling you, Lars, as a guy that takes care of people with sleep disorders? You need to start reading them the riot act. You know how like Uncle Jack comes on the podcast? What does he do? He punches you square in the mouth, kind of like I did a little while ago with Benny. Why? No, don't jump around. Stay on point. So you get the message loud and clear. Why? Because what's really at risk here, Lars? What's at risk is brain damage. That's what we're all really trying to avoid. And that's what I want you guys to understand, so that when you have patients come to see you in Germany, that you give them good, decentralized advice that the doctor is not going to give them. Why? Because we just told your audience why. They're incentivized to give drugs. You cannot make any money from the sun. Okay? This is the unfortunate truth to decentralized medicine. But what is the great news for the people who are in your audience listening to this? The sun is free. Maybe not in Germany, because you may have to go to a better place, but guess what? Even if you decide to use what you have in Germany, spending the money on a red light is probably way cheaper than a life of Ritalin or a life of melatonin or a life of sleep medicine. And certainly, I do not want people, to really use a machine that makes you worse, because why do the sleep doctors tell you that? Because the more you use the machine, the more of a patient you become, the more they harvest money out of you. And remember what I told you in my little diatribe about centralized medicine. It's a very expensive sausage grinder to go into.